This educational video focuses on describing the role of oxytocin in stress response and its importance to health. The main points of focus will be the definition of oxytocin, its secretion and production, how it affects one's health, the physiological actions and how it can be manipulated to benefit the well-being of an individual or to maintain health. First things first, what is oxytocin? Oxytocin is a peptide hormone which is normally produced in the hypothalamus and is released by the posterior pituitary gland. It can also be defined as a neuropeptide that is synthesized in the brain by hypothalamic magnocellular neurons and released from neurohypophyseal terminals into the blood and within defined brain regions that regulate emotional, cognitive, and social behaviors. Repeated exposure to oxytocin causes long-lasting effects by influencing the activity of other transmitter systems, making it a potentially clinically relevant hormone. Like many other hormones, oxytocin has its own special or specific functions. The two main functions of oxytocin are the contractions of the uterus or womb during childbirth and the regulation of lactation in females. It also, however, influences anxiety, interpersonal bonding, and reproduction and stress responses.
As stated before, oxytocin functions as a stress coping molecule with protective effects, especially in the face of adversity or trauma. It also functions as an anti-inflammatory, antioxidant, and immunomodulatory. In males, it plays a role in sperm transport and the production of testosterone. Oxytocin enhances socialization, which includes motivation for pair bonding, sexual activity, affiliative preference, empathy or emotional IQ, and parental behavior. It can also serve to enhance protective behavior in an individual and calms things down. That's why it is known as the cuddle or love hormone. Since it is more effective in females during pregnancy, its reflex is known as the let down or milk ejection reflex. So, a stressor is any external factor that disturbs homeostasis, and stress response is the body's action to re-establish homeostasis. Stress response involves coping or dealing with a stressor by involving interaction with different body systems. It is a coordinated reaction that is characterized by avoidance behavior, increased arousal, and stimulation of the sympathetic nervous system. The hypothalamus is centrally involved in coordinating the adequate visceromotor, humoral, and somatic motor responses. So, how does oxytocin help in stress response? The physiology of stress response entails the hypothalamic pituitary adrenal axis or HPA axis, which is the central stress response system, and the autonomic nervous system. After a stressful event or thought, the hypothalamus will secrete oxytocin into the hypothalamic PET circulatory system, with corticotrophin releasing hormone or CRH as the principal releaser. This hormone will trigger the pituitary to release corticotrophin within 15 seconds, and it will then reach the adrenal gland and trigger glucocorticoid release within minutes. Stimulating the neural triggers of HPA axis, namely the anterior cingulate cortex and amygdala, can trigger an increase in cortisol levels in the blood. Oxytocin will then induce anti-stress-like effects such as reduction of blood pressure and cortisol levels. It increases pain thresholds and exerts an anxiolytic-like effect, as well as promoting growth and healing. Okay, so now let's talk about the importance of oxytocin in health. We'll start first by discussing its role in childbirth. During childbirth, oxytocin causes the uterine muscles to contract, signals womb or uterine contractions, and leads to labor. It also boosts the synthesis of prostaglandins, which speeds up labor and intensifies contractions. Due to these effects, synthetic oxytocin, commonly known as pitocin, is occasionally administered to induce labor if a woman is unable to do so naturally or to make contractions stronger. Oxytocin also stimulates breastfeeding by transporting milk into the breast after the baby is delivered. When a child suckles at the mother's breast, oxytocin will allow the milk to move freely so the infant can eat. Oxytocin makes milk that is already in the breast flow to the current feed because it is produced faster than prolactin. The positive feedback cycle will be maintained until the baby stops suckling. Sexual activity has also been found to stimulate the release of oxytocin. How? It appears that oxytocin has a role in erection and orgasm, and there has also been a proposed correlation between the concentration of oxytocin and the intensity of orgasm. The reason for this is not fully understood, but in women it may be that the increased uterine motility may help sperm to reach their destination. The link between oxytocin and fidelity may begin with the hormone's ability to make males view their partners as more attractive than other familiar and unfamiliar females. Research from 2012 suggests that oxytocin may influence males to keep a greater social distance from attractive female strangers, and this may be due to its influence on reward pathways. Engaging in sexual contact with your romantic partner may increase oxytocin levels and therefore creating a behavior loop. Secretion of the hormone leads to rhythmic muscle contraction and ejaculation. The larger or greater the release of oxytocin, then the more intense the orgasm. Also, people with high levels of testosterone may probably not feel the connection because this hormone suppresses oxytocin activity. Oxytocin can be released by various types of non-noxious sensory stimulation, such as touch and warmth. The release of oxytocin can also be triggered by ingestion of food and stimulation of other senses, such as olfaction and other types of sound and light. In addition, purely psychological mechanisms and various types of psychotherapy may trigger the release of oxytocin. The amount of oxytocin levels in the body will result in different outcomes, of course. When the oxytocin levels are too high, then it might lead to a condition called benign prostatic hyperplasia, being an age-associated enlargement of the prostate that can result in urination difficulty. When the oxytocin levels are too low, a nursing mother will not be able to breastfeed the infant since the milk ejection reflex will be prevented. It is believed that it might also be one of the key elements in disorders like autism, autistic spectrum disorders, and depressive disorders.
Oxytocin is released into our brains under the right circumstances, and thanks to it we get a toasty, tranquil feeling wherever we are with the people we love and care about. And the more we engage in these feel-good behaviors, the more oxytocin we get. You might even call it addictive. So how can you easily increase your oxytocin levels when you are down and out? Physical touch and socializing is one of the fastest ways to increase your oxytocin levels, so remember to hug your loved ones tight. And in this day and age, observe the COVID-19 safety protocols. Taking a walk outside to get some vitamin D will also help a lot. Exercising has also been proven to be one of the most effective ways to raise oxytocin levels. Doing that for at least 10 minutes per day will help a lot, so move that body, lift those weights, or go on that run to get some of those great benefits oxytocin has to offer. Taking time to listen to your favorite music often raises oxytocin levels, so dance away. Even though these are said to be the most effective ways to raise your oxytocin levels, it is important to do your favorite leisure activity. Do what you love, something that makes you happy.